Hi, everyone. Thank you for joining. We're going to give people a few seconds to get comfortable and make sure their audio is all settled before I get started. So while you're doing that, I just want to thank you again for joining this webinar today. This is the part 3 question and answer session from our original webinar, Supporting College Students with Mental Health Conditions in the Wake of COVID-19. We hosted a question and answer session yesterday and it was super popular, so we're doing a part 2 question and answer session today. Your primary presenter will be Michelle Mullen, who I'll tell you a little bit more about in a minute. And our group is all from University of Massachusetts Medical School, Transitions to Adulthood Center for Research. Next slide. I just want to thank our funders and our organization, UMass Medical School, Transitions ACR, and our funder, Neidler, for without whom we would not be here today. So a little bit of housekeeping. You've probably heard this a lot in the last couple weeks, everyone going virtual, but to make sure you know, our recording of this webinar is going to be posted on our website as well as the other question and answer session and the original webinar. We will give you the link in our chat box. It's up here briefly if you want to jot it down, otherwise you can find it there. Live captions can be accessed by viewing the link, which has also already been pinned to the top of our chat session if you are looking for live caption services. And if you're having any issues with audio, tech, you can email our communications guru, Dee Logan. Her email address is on the bottom of the screen. And you are all muted because of the large size of the audience. However, we do have question and answer features for you to utilize. Next slide, please. How to do that. So when you see on your screen, the top right-hand side is probably your panel. The bottom part of that is labeled questions, so that little gray line in the middle. Under that, you can submit a question to Michelle at any point throughout the whole webinar now, while she's talking about a topic that jogs your memory anytime, and we will be collecting those questions to get as many answered as we can throughout the hour. Next slide. So who are we, these mysterious people behind this webinar today? We are from the Transitions ACR, and we are a national center that aims to improve the school and work activities of young adults with serious mental health conditions. We look at young adults as 14 to 30, and we try to improve the lives and success of young adults in a couple ways. We conduct a lot of rigorous research that supports employment and education goals of young adults. We develop and disseminate as much information we can about our lessons learned through our research and our experience working in this field, hence why we're hosting things like webinars throughout this work from home experience. And then we also hire and train young adults through a methodology called participatory action research, who are young people with lived mental health experience who help inform all the work we're doing. Next slide, please. Who is presenting today? The famous woman behind the curtain, who will be with you shortly, is Michelle Mullen, which is the developer of HYPE, Helping Youth on the Path to Employment. And that is really the college model that we're going to be all kind of focusing on. Michelle has developed support education programs over the last 17 years to help college students with mental health conditions stay successful, graduate, and have a good experience while in college. She's also worked with a lot of agencies and organizations across the country and beyond to help them implement programs to support college students. Hence why she is the perfect speaker for today's topic. Myself and Debbie, who will be helping with the discussion, are also part of the HYPE team. And so why are we talking about HYPE at all? So HYPE is the model that has helped us create the resources to develop this webinar today. Helping Youth on the Path to Employment is a career service which is focused on combining education and employment supports together to support young people who are looking to go to college or VOC programs and just get education and translate that into a rewarding career. So we thought that this webinar could be helpful for many people, but especially for those who are interested in the HYPE model and beyond. If you're interested in the HYPE model, you can contact us and we will put the website link that's on the bottom of this screen through the chat feature in a couple minutes, so you also have a way to get in touch with us. You can visit our website, shoot us an email. We are here to provide support and guidance to other folks who are interested in supporting college students with lived experience, so don't hesitate to reach out. I'm going to now turn it over to Debbie, who I mentioned earlier, who is our HYPE training director and will be helping to facilitate the discussion as we walk through question and answers for Michelle.
Hi, everyone. I'm Debbie Nicolelis, and that's Michelle Mullen. And Michelle will be talking in a moment, but we're going to try something new today. We're really excited. We thought we would ask you what you most wanted to hear about as we get started. We really want to make sure that this webinar is tailored to your questions and your interests. So in a moment, Amanda's going to pull up our first poll that will ask the questions of, which content area are you most interested in? Are you interested in engaging with and attending to at-risk students? Are you most interested in helping students to complete their coursework at this time, this wild time of COVID-19? Or are you thinking about taking care of the caretaker, supporting the people who are supporting the students? So take a moment and select one that you're most interested in. We'll give you a moment to log your answers.
So Debbie, we've had about 60% of our audience voting. So take a couple more seconds to get your final votes in.
Thank you, Amanda. Thank you, Debbie. I was just, I was on mute while I was saying this, but I was saying the reason why we're doing this poll is that yesterday we did the same type of question and answer, but because we don't have the interactivity between you guys and us, we couldn't tell if these were the questions that the order that you wanted or what the preference was. So we're hoping that by you responding to the poll, you can help us prioritize what questions to move through depending on what you need. Now, some of you folks have already asked us questions, which when you registered, then they are in kind of the list of topics here. So hopefully we'll be able to get to all of them. And once again, please use the chat function as well.
So Michelle, a strong majority of our audience has responded. So I'm going to close the poll so they can see you again. The results were a 74% agreement with the priority topic being engaging and attending to at-risk students. So we have a pretty strong majority for that question.
Great, great, great.
Okay.
Great, so let's get started then.
Okay, well, so I may start with a question that came to us from the registrants for this webinar. We also will be bringing in questions that came in before our original webinar last week. But one of the first questions we got for this webinar was, how can we stay connected with our clients who are college students during this time of social distancing?
So I think this is a good question. Did I just change the slide?
Yes, but
okay.
We can see the at-risk student slide.
that was an accident, but technological issues. Okay, so the best way I think with connecting with students, this has been a hot topic in our first webinar. People's comments afterwards were, well, it sounds like you're assuming that people are connected with their students right now. And some people are, and some people are not. And I think one of the greatest learnings that we can take away from this experience is to get students contact information across all areas, particularly in like social media domains. So not just their phone number, not just their email, but also like what's their Instagram handle or who are they on Facebook, right? So in these ways that we have multiple ways of engaging or trying to get into contact with students. We know that college students, sometimes phones get disconnected, right? Or they change their phone number. So some of the practices that we've done within HYPE is being able to ask people when they first come into services, this is both for research and for practice, or what are your preferred ways of getting in contact? And if I can't get you that way, what are the other ways that I can get in contact with you? And we do that because sometimes students become disengaged, and sometimes we worry. And so being able to contact people that they give us permission to contact is helpful. So I think that one of the things that we should be thinking about are, what are the alternate ways that we have to get in contact with students? So those of you who are campus professionals, you are also, one thing that you may want to consider is thinking through Is there a way that we can use our school social media to advertise or to engage at-risk students? So are you having a hard time finishing your coursework? Are you feeling really lonely? Are you isolated? Right, so blast that out through your school's Instagram handle or Facebook page, or what the ways that your school used to market themselves, but particularly to their students. Some other ways that we've used for those of you who are on community-based services or fund community-based services is thinking about, like, do you put up like a Facebook ad? You have to pay for that, but it is a way of like really strategically targeting a demographic in particular areas. So you can say, are you a X university student? And you can fill in the blank whatever universities are around you. And are you feeling lonely? Do you have a mental health condition? Are you struggling to finish school? And so that costs a little bit of money, but what it does is like it flags people in Facebook that meets these demographics, and then forces the ad into their feed. So for those of us that need to engage students or to bring in students who have not yet been our service recipients, disability services can use this, CAPS can use this, universities can use this, supported education programs, folk rehab, any organization that focuses on this kind of shared population, I think would be thinking creatively of how do we use these types of outlets. So I think a lesson learned from this is if you don't have the social media handles for your students, that's one of the things that you should put on your intake after this.
So really, we need to reach out in every way we can, including, and maybe most importantly, social media. I really appreciate that.
Well, that's where they are. It may not be where we are as old folks, but like that's where younger people are. So meet them where they are, right? And thinking about how we can be creative and innovative. I think also moving forward, for those of you that provide services, having a young adult board to give you feedback of like, during this time, it was really helpful when people did this, or I would have wished that you would have done this. This is also a way to be reflective on our own services, to be more tailored to young adult needs, especially during crisis. I mean, it's unprecedented. No one knew this was going to happen, but we have displaced hundreds of thousands of college students, and a large percentage of them, nearly 20%, have mental health conditions. So thinking about how we move forward differently, I think, is important.
I agree, Michelle. And I think we have a couple of questions, both from those registrants for this webinar and folks who had asked questions previously. And I'll encourage people to write questions that you have now about this topic into the questions area. And so that we can catch your questions right now. It's the best way for us to answer questions that are on your mind in the moment. But let me bring one in that has to do with serving young adults with mental health conditions in college that have come up. One was about how do we address students who have anxiety about using webcams for online testing and Zoom meetings, etc. And another related question was, what if video conferencing isn't even available?
So let's start with the non-available first, I think, because we do rely a lot now on video conferencing in some type of, or video calls, right? And so if they're totally not available, then we have to do it like the old-fashioned way, on the phone, right? Take pictures, send it to me. And many of the folks that we have served in young adults and older adults in college really require assistance with kind of like the organizational components to just get it done. And that's hard to do without seeing it. So being able to send pictures or describe video calls are probably the best. But if your student doesn't have a smartphone with a camera, or a laptop with a camera, then thinking through like how do you manage that, I think, is a more difficult one. And if you're in that situation, please reach out to us because we can be good thought partners to you. I think a large majority of students do at least have a smartphone with a video camera. So if the barrier is on the provider side, I think considering like what are the workarounds right now, because this is unprecedented. And if you have policies and procedures that say no texting, no video chatting, you may need to reach out to your supervisors and the people above them about what are the different things that we do. So identify what's the barrier on what end. Is it the student barrier, and how do we resolve that? Or is it the program or institutional barrier? And are there ways of working around that given these times? We've now seen programs that have said historically in the past, we don't do telehealth, we can't do telehealth, are now doing telehealth. So here the hard and fast rules now become squishy and loose. So if you are dissatisfied with a rule, now is the time to push against it, right? So be creative. Think, don't go rogue. I think this is a very important thing. You don't want to get fired as a result of like being creative to help students, or maybe do, I don't know. Sometimes that's what happens, but thinking about how can we be creative and work within our constraints. And once again, should you need additional thought partnership on that, we can help you individually. So about students that have anxiety related to video conferencing, if your student that you're working with is connected to some good treatment provider, this is where collaboration across providers help, right? So what are the ways that have been helpful in the past in reducing anxiety about use? It could either be of technology or anything else. I think that some of the things that is hard for students right now, particularly around using technology or using cameras, is that they're required for class too. So all students' classes have gone online, and there's a requirement often that your camera is on so your professor can see you there. So I think working through some good treatment strategies, this is such a hard time because sometimes even treatment providers can't be seeing folks. So you can't say like, okay, so now let's start CBT, and let's desensitize you to some of these anxieties. And it's not, now is a very different time. So thinking about like, what are the barriers? How can we help with that? Are there particular things that we can do to get around using a camera? So do we need to advocate for an accommodation? Should that be something that you literally cannot do because of other factors? So I think if it's just the preference of a person not to video, that's okay. If they working on that, I think is another thing. But then if it's because of the condition itself, are there accommodations or assistive technology that can be used? Sometimes people use avatars as compared to their own picture. So thinking through like, what are the ways that we can be creative here to get the needs met? So if we were talking about services and helping someone to get like organized or set up or figuring out how to do the workspace, just flip over the camera, and so that you can see the space instead of like the person staring at you and you staring at them. So I think that there are some ways that you can use the camera, and some ways that you may want to think about, is this a place where there's an accommodation, assistive technology, or some other kind of creative workaround?
That's super helpful. I know a lot of people are using backgrounds and fun avatars and things to lighten it up a little bit and kind of give a different flair. So that might be something kind of an easy, natural way to do it. Not so easy for me, but it might be easy for the students.
Easier for young people.
Yeah, that's right. Well, and on that topic, Michelle, we've had questions coming in about how to best support students with different mental health conditions during a time when they're more isolated and, alone, and trying to do this entirely new way of participating in school. So the mental conditions piece has come up a lot.
So I think that people assume that this is hard for everyone, and it's hard for a lot of people. But for some people, this is actually much easier than their regular existence, right? So some people are happy to be at home, happy not having a lot of social contact. So for some people, this is not distressing. So identify with your students or the people that you're working with, like, is this actually uncomfortable for you? Are you largely more comfortable than having to get out of your dorm room and walk across campus? And if people struggle with social anxiety, then this actually may be more preferred than before. Now, whether or not that's good for the long run or the short run, right now, this is where we are, and everyone's kind of home. The thing that I would say about the mental health condition is, as compared to some other disciplines, if you are working with someone who has bipolar, for instance, and you're working with 5 different folks, bipolar looks different for each one of those people. So I would encourage folks to ask students, like, how is this affecting you? And to identify what we call the functional implication of the condition. So this affects me in this type of ways. These are the symptoms that I have. Some young adults talk about it like that, some young adults don't. But like, how is this getting in the way? Like, what is the actual implication of this on your life? I'm having a hard time like regulating my mood, which means that when I'm supposed to go to class and I'm feeling really down, I'm not going. All right, so then how do we work on that? Is it a prompt that we send before? Do we send, a funny meme, or do we incentivize you going? Like, what are the ways that we can get you to go to class? To really identify what is the functional implication of the condition, because all conditions affect all people differently. They may have the same name, but they don't affect people the same way. So we had talked about this in the first webinar, which is really doing a thorough needs assessment. Like, what does the student need? It could be basic needs. It could be more complex needs. It could be kind of foundational academic needs, like organization or being able to send an email. And then crosswalk that, like, is the condition getting in the way of being able to do those things? Is social isolation getting in the way of doing those things? So what are the factors? And right now we have so many tangled together that it's hard to parse apart a lot of the time. So I think for the mental health condition is really have a really good discussion and try not to focus on disability. Like, you're not able to do this because of that, but rather, what are you struggling with and how can I be helpful? What we know from young adults is they will come back to services if you're helpful. They will not come back to services if you are not. So try not to put the program goals before the student goals. What do they need? How do we get it? Who do we collaborate with? How do we connect people? And that way your students will stay engaged as much as they can, because this is like it's a hard time for everybody. So the second part of that question was about the mental health condition, but the other part I think you had said was about the social isolation component. And so I think this goes back to my original comments, which is like, not everyone is struggling. Some people's lives continue to be the same, like the people that we know that game all night. Their life doesn't change. Lots of people don't go to gaming parties. They, turn on their computers and they play with their friends online. And so we do see a lot of these types of virtual hangouts for young adults. And I think that the folks that we're most concerned about are those that are not connected socially or can't figure out how to connect socially. So they don't have those friends or the instant communities that, like, let's say, PC gamers have, or they can't figure out how to do the same types of hangouts before. And I think that there are some innovative ways that are coming up for people to do that. In our last webinar, we had put up some resources from Boston University's Center for Psych Rehab Mateo's project, which is doing like virtual hangouts where you can come together and like chat about sports or like other types of activities. So there are more and more of these things coming online because of this. And I think this is like one of the cool things about young people, technology, and the gig economy, is that as more and more of these needs become aware, there's going to be more apps for people to like experiment with and to try to connect with. So I think a part of what our job is to keep our ear to the ground about what is happening. But I also want to make note that some people won't use new apps. Some people won't go join a new group. And to feel like someone cares about you and is connected to you, sometimes it is the provider that's sending the message like, hey, thinking about you, like, why don't we go out for a walk today? Like, something that shows that people care. You don't need to have 500 friends. You need to have some people that tell you through hard times that like things are going to be okay. They're not alone. And if they need help, there's someone to help them. So I think that it's important to try to develop some community. I also think it's important about the message that we send to people during these times. And I think we all see everyone's for those of us that serve students that are displaced, we're also displaced too, right? Everyone's working from home. Everyone has this like burden, or I don't know, it's definitely different now. So we are doing the things that we can. What we've heard from young adults is, if I don't tell you to stop texting me, don't, because it helps. So that is also something to make note, that if someone is not responding to you, but you're sending encouraging, nice, connecting messages, that it may actually be helping. So don't stop.
That's super helpful, Michelle. It's making me think about a young adult leader that we know who is conducting virtual walks together, through FaceTime or whatever it is on the phone, but people are joining in and taking walks separately in their own areas, but together, which is a really lovely idea. It's something we can
Yes, it's
learn.
very sweet.
Yeah.
Yeah. And so I think making these types of suggestions to people is critical, like things that people may not like. Why don't you cook with a friend? Why don't you plan? It's not like, all right, let's make this together, and you're making it together at home separately, right? So I think that there are some things that we can like have some creative suggestions. But once again, like the young adult communities are going to be coming up with this. So don't rack your head to come up with something creative. Go do a Google search and find something to suggest. It's those people who don't have a person to do that with that I think that we're concerned about. And some of those people are okay being like left alone for a little while with some sweet messages, and some people are not. So I think we just have to be aware of the risk of these individual students and how do we help those.
Yeah. That's awesome. And we're also, we've gotten questions about how to help students adjust to this new online environment. So we've been talking about how we can help students kind of connect with us and connect with each other and communities that they're involved with. But they're also connecting with their schools, their classes, their professors. And sometimes the professors aren't so helpful.
Yeah.
Because they're struggling too.
Yeah. Well, I think that this is a complicated consideration, because if a professor under regular circumstances like ghosts you, that's one thing. But now where it's like the wild west, I mean, there's this term now, it's called panic-goji. For those of you who may have heard of this, is it's panic plus pedagogy, and pedagogy is like the style that you teach. And right now, the style that we're teaching is panic. Right? We had professors who've had a week advance notice to turn all of their in-person classes, including things like art and karate, into online platforms. I mean, consider the type of professor you know to teach chemistry, and what it must have been like for someone like that to convert their in-person chemistry class to an online class. So your question is about like the new normal of school and how to manage that. And I think that professors are struggling too. Students are left without resources that they otherwise have had. And being able to get our needs met. I'm a huge fan and big advocate of advocacy. And so if students are struggling in class, but their professors have gone dark, they're not responding to emails, they're not doing classes on time, or they're doing it in an asynchronous way where they're doing a video of themselves or posting PowerPoints, but you can't get clarification. The Canvas site or Blackboard site is a mess. You can't find your assignments. This is the reality for some students. But then what do? Do you send a note saying, like, I need for this to be more organized? That person's in chaos too. So figuring out how do you support a student to manage their own feelings about this and the stress associated with not being able to turn assignments in on time, not being able to find assignments, not being able to organize themselves because the professor is not organized. So how do you craft a note to the professor saying, like, I recognize that this is hard for you. It's also hard on us. Can we have some clarity? And so, we have talked with our providers about being assertively sweet, kind of like a sweet animal. So you first are like kind, and you sandwich it with like, I know this is hard for you. These are the things that I'm struggling with. I know that you probably have other things you need to attend to. So if you can get back to me by this date, it would be super helpful. Hope all is well with you. All the sweet things. So you sandwich the request in between sweetness. And then you send a couple of those. Like last week, I had sent you an email, last Friday, this may be Monday or Tuesday. I sent you an email about these things. I'm hoping everything's okay and that your lack of responsiveness is not because things are bad, or, to make the prompt that this is, you haven't responded to me. And then I think you escalate that up. I think that in this situation, if students have a provider that is an advocate for them, it's very, very helpful here, because we can be kind of we can be the wolves in the corner, right? So like if there needs to be someone that says like this is not fair, then there is that. But there is this the pulse right now of schools that we know is wildly unfair for students, and so I do believe that people will be more lenient, but having a trail of kind of the nice email saying like I need help in the event that the professor chooses to fail them on a pass fail or give them a unsuccessful. So I think that there's some paperwork that should happen, but also helping the students to manage that increased stress and burden, because then what do you do? And I think ultimately you escalate it to the chair and to the dean. And that's where it's helpful to have an advocate, because then the stress for the student also reduces and they're not alone. And often you don't want to say, I have a mental health condition, so I need this. Everyone needs it right now because it's chaos, right? But thinking about, are there accommodations in assistive technology or even protections from the Office of Accessibility and Disability Services that would be helpful, I think is important. So one of my perspectives, Debbie, is that that mental health can be exacerbated by stress and loneliness. We know that, right? And this is an incredibly stressful time for students. So any ways that we can reduce stress by increasing support is helpful. Our goal is to help students persist in school. And we know that students with mental health conditions actually have the poorest persistence rates of any group, including freshmen. So then how do we increase support and reduce stress? And then helping craft emails, right? Do follow up with people, advocate. These are the ways that we can be helpful to reduce the stress and students feel as if they have more support during this time, even though it's at a distance. Did I answer the question?
I think you did.
Okay. I don't know if there was a second or third part. Yeah.
That's right. No, I haven't seen any additional questions, but one of the things that you talked about in there was helping the students to get organized. And one of the major things we can do for students right now is help them with the supports that they need, but also the skills that they need. And I'll mention that Michelle talked about a lot of different skills and strategies that providers can use to help students in the original webinar, which is on our website. But do you have other comments about that now, Michelle, before we go on to the next topic?
Well, if you haven't watched the first webinar and you're so inclined, I do think that it's smart if you don't already, if you're not already shoring up kind of like those basic academic skills, it is a good time to do that. Everyone has made this transition, this switch from dorm room to some other type of home, and people are not set up for success. And how do you manage if you're a classic undergraduate student, like moving home to your parents' house and trying to figure out how to get things done, or if you're moving out of your house and you don't have, dorm, and you don't have a home to go to. So people overlook the organizational strategies because they think that they're the basic needs and it's not just like mental health symptom related. But arguably they exacerbate stress that people have. Think about, for anyone here, when you feel out of control, one of the best things to do is get organized. So there's like some sense of control, like, okay, I'm going to do this first, I'm going to do that first, right? Any problem requires an organizational approach to it. And this is a problem. So like thinking about like, what are the steps that how do we accomplish this? Like, how do we get through COVID? Like, there are certain things. We need basic needs. We need basic skills. We need basic support. We need to be able to be set up for success at home. And lots of people with mental health conditions struggle with executive functioning skills. So they may not like right off the top of their heads think like, okay, I need a desk that's clean where I can put my stuff. I need to organize my stuff so I can find it. I need to figure out how to navigate my new Canvas. I've never been on Canvas before. Like, how do I do that, right? So these are the types of things that build up, that take up bandwidth and build up stress and anxiety that then exacerbate everything else that we're feeling. So if we can close out those screens, essentially, like reduce the static around not feeling organized and not knowing how to approach the problem, is incredibly helpful for people with or without mental health conditions. But I do encourage people not to overlook those kind of foundational skills, because if you don't have the foundation, it is going to be very, very difficult to finish out the next 4 weeks of class. Incredibly difficult.
Yeah, thank you. Michelle, the second highest rated topic was completing coursework. And I'm going to ask Amanda to put up a poll that will ask the audience, ask all of you, which topics are most important to you. We have over 20 minutes to talk about some of these topics. So is course completion and motivation important to you? Time management and the new structure, balancing school and childcare, supporting non-traditional students, or resources, disability services, and accommodations the most important? And we'll take note of the several highest rated topics for you. We'll give you about a minute.
Or you just answer fast and we don't have to wait so long.
So Amanda, let us know when we have a good number.
Yep, let's give people 5 more seconds, and then I think we're in pretty good shape. So get your final votes in there if you're reviewing these 5 options and struggling to pick your number one.
We mostly want to know where to start.
All right, so we have our top option is time management and the new structure.
Okay, great. Is there a second highest, Amanda?
Second highest was resources, disability services, and accommodations.
Great.
Yeah,
Okay,
that's good to know.
that's fantastic.
So, Debbie, I'm going to ask our audience to do me a favor. Accommodations and assistive technology is a big, big domain. So what I'm going to ask you to do, if you have any specific questions, put them in the chat now, and Amanda will feed those to us and to Debbie. So just be considering, like, what about this do I need to know? Is it the process? Is it how do I get them? Or what are good accommodations for students that are now remote? Like, what about it? What about it is would be helpful for you? Okay, so the kind of like the new frontier is where we're starting, right? With the new structure and time management. Do we have specific questions around that?
Yes, people have submitted questions. Here's one about the new structure, right? The new structure for students these days is that students are struggling to structure their days differently. How can providers help with that?
Well, so I think that it's still somewhat guided by their schedule. So some of our professors are keeping the same time. So you need to attend to your classwork in the same type of way, right? So my classes are on Tuesday, Thursday, 1 to 3. So you have to be in front of your computer at that time. But one of the things I think that at-home parents are struggling with this too, which is don't make it harder on yourself than it needs to be. So this idea of you get up at 8 o'clock anyway and you brush your teeth and you get showered and you make your bed and you put your shoes on and you do all these things. Like, don't make it harder than, not everyone needs to do that. And I would encourage not to make things more difficult. And so some students have this expectation that they have to do certain things. And I think if we're helping students figure out how to get through this, is like, what are the critical things that we need to do? What do you need to do to feel healthy and good? What brings you into a positive space? And what are some of these habits that you do that are good for success, right? So that's really what we want for people to do. So I think the new structure looks very different based on what your home life is. So if you're a parent going to school, then your life looks like a disaster. If you're an 18-year-old, then your life looks really different than a 36-year-old single mom that goes to school. So I think considering what's the demographic, what is the structure that we need to be successful, and then how do we get to that end? So I think that some people are time management folks, some people are task management folks. I think here we're leaning more on the task management end because there's so many things. I think that you guys can see working from home. I just had a kid schlub onto the couch behind us. So I mean, these are the things that happen now. Like the students are going to be in class and their professors' kids are going to walk over, they're going to take something, they're going to ask for an apple. So there is a lot of kind of like relaxed expectations now. Everyone should know that life changes after this. But I think for structure, some people love it and then do that. Wake up in the morning, go for a walk if that's what's helpful for you. But some people are like, this is not helpful to have these false expectations that I'm going to keep a particular type of structure. With that said, structure really depends on the person, but knowing what needs to get done does not. So to be able to finish our classes, we need to know what the expectations are. And so asking the professor, like, what do I need to do? Is there modifications for attendance? Are you going to record all the classes so if I can't come, I can still get the information? So understanding the expectations of the class, understanding what a pass-fail option is. Do I have to do all of the work to be able to pass this class? What's an incomplete option? Do I have to do that? Because I think structure really also dictates like what can I actually get done under these considerations. So what's the task that I have to do? When do I have to get them done? How much time is it going to take to get those things done? So structure for everyone is going to look very, very different.
I always have to remember to unmute myself, Michelle, hence the pause. So that's really helpful. I think related to this topic and very timely, we had a question from the audience come in about recommendations for the kinds of planners that can help keep track of their work and their things that are due. So I'll hand it.
Whoever you are, we are kindred spirits. I love you already. So planners are super important. So I was talking about time and task management and schedules, and often like there are very few people that do well with no schedule whatsoever. So I don't want to make it sound like that. So I have preferred calendars for students, and I have preferred ideas, or ideas that are preferred, whatever, however you would say it. My ideas about preferred calendars are different based on what a student needs to do or a professional needs to do. So if you are very high in your student standing, you're a senior, you're a graduate student, you're a PhD student, there are more demands on your time and there are more tasks that are independent that have to get done. Now, if you're an undergraduate student, one of my favorite calendars, I do not have stock in these people, so I don't make money by saying this, is that there's this calendar maker called Dayminder, and they have a week out of you and a month out of you. So when you open it, it's 7 blocks, each one for each day, and they're just a big block. There's no time in it, and then there's one block for like your to-do list. I love that for students because they can put it in there, they can write it in, they can put an additional sticky note, right? So they put in there when things are due, what's due, they put in their classes, so then when they look at it, they remember. So that's for a paper person. I like that for a paper person. For an electronic version, any of the electronic calendars are like generally the same. And for that, it's very, very similar. It's like you plop in the things that are due, when they're due, when you have classes. I personally like to break out chunks of time when I know I have to do something. So if there is a paper that's due next week, like when am I going to do the intro? When am I going to do the body? When am I going to do the lit review? And really chunk those out. And then when you're using electronic calendar, you can then move that around. So let's say I don't get to it on Tuesday. I can move the lit review to Wednesday, but knowing that there's a block of time that I need to do that. Because now we're in the situation where there is no, you don't go to the library to do work. You don't go down to the student center. You have to do all these things by yourself and self-imposed. And maybe some of your friends, for those college students, have other friends that they can study with, like through Zoom or through FaceTime or WhatsApp, and that's great. Some students don't have that. So figuring out how you create that schedule. And I think this is where providers can be super helpful, and they don't recognize that this is really a critical thing. It's just setting it up so you can get the things done, especially now when the stress is high and people are anxious about finishing. So just as a note, time management is critically important. Having something to organize yourself is critically important, but also figuring out what you're working towards right now is even more important. Are you working for a grade? Are you working for a pass-fail? Are you working for an incomplete? So these are the types of things that students should know, and they should know what are the implications for each of those things, and then what are the requirements to be able to meet that end. And please use the chat function if you want to know any more about the pass-fail, incompletes, or the implications for medical withdrawals.
Mm-hmm, mm-hmm. Yeah, and I think I'll move then to some of the questions about resources, disability services, and accommodations for our last 10 minutes, but keep an eye on the questions that are coming in, so do keep those coming. One of the questions that came in from folks who are attending today's webinar was, what are the most appropriate or utilized accommodations in remote learning right now?
Yeah, I think that this is a very difficult question. And we have had some schools that have been online schools for a long time that are putting out recommendations now, because before they struggled with how do you accommodate people remotely, because some things are different, right? You don't have to get a quiet test taking space, and lots of disability service time is spent up like figuring out how do you arrange the proctor and how do you arrange the space. And so I think thinking about like what does the student need, you can't actually, there are certain things that we have to modify, right? So note takers are still options. There are other people who are attending class. I don't really love the note taker option. One is because students take notes for themselves, and their note-taking strategies may mean very different things or have holes for a second reader. So I do suggest certain assistive technology to help with note-taking for students, like digital recording, smart pens. One of my favorites, some of you may know, is Notability. So thinking about, well, is there an assistive technology option? I do think that extended time on assignments and coursework is actually one that remains really helpful here, and probably more so than general. Oftentimes people, when they have more time, it just takes them more time. The difference here is when there's like a reduction in processing speed, where some folks with mental health conditions do have implications to processing speed. I think here in this type of situation with COVID, that probably every student could benefit from extended time, given that their lives don't look the same, and people have a less, smaller or a reduced amount of attention to be able to devote to work, let alone distractions of being at home and not being able to go out. So I do think that thinking about those options are important. So extended time on tests if professors are still providing tests, on time tests online, which some of them are doing. They're not all take-home tests. So I think thinking about when we had brought up functional implications the first time, and considering what is the functional implication. Is it attention, right? Concentration? Is it focus? So is it the ability to express oneself logically in writing, right? So if those are the implications, then what is the assistive technology? Right now, I'm a big fan of the AT as the option, which is, are there things that we can connect students to at home that are available in either app version to help them, organize their writing? Lots of students no longer have access to learning access labs on campus, which may have had software like the software on those labs, like scanning and visualization software that they no longer have access to. So how do we do that? And was it critical? So I think that some of this is the burden of disability services now, which is how do we make classrooms as accessible, right, as we had when students were on campus. And I think it's even more important for students, providers who are not on campus to partner with the disability service folks on campus and say, this is what we're struggling with. Like the student can articulate it, the providers can articulate it too, like how should we be doing these things? Disability services is a great thought partner because this is kind of like, this is what they do, right? And so everyone here is learning. There's a learning curve and there should be like partnering around that. And my argument is that people should be given more latitude during these times because we don't know, and we shouldn't hold students to a harsher standard when we don't know what this actually looks like. So some disability services or accessibility services are like pretty flexible and think like, all right, well, this is a functional implication for this condition and this environment because the environment now changes, right? And so we know that disabling conditions are results of environment and condition. So they're now in a different environment. And so some disability services are being super flexible. Okay, what do you need? How do we articulate this to your professors? Do you get extended time where in the past you didn't need that? Do you need the lecture notes because your professor is not organized, and now is that like an undue hardship or unreasonable for the professor under these constraints? I mean, this is like a host of problems on campuses. So I guess one of the things I would also say is be patient, be gentle, but also advocate so that your student is not penalized in the long run because schools are trying to figure out how to accommodate students. This is a partnership effort. Everyone can learn. And I think at the end of this, we'll have some like revised beliefs and processes as a result of COVID, right?
Yeah, I think that's about right, Michelle. And you really covered disability services, how to really advocate for students. I guess as we wait for any final questions that may come in, I'm wondering if you have sort of the big take-home message for this webinar. What's the final take-home message that you might have for people in the last couple of minutes?
Well, let me put a fine point on the disability services first, and hopefully I have a big message, but disability services are figuring out their way too. But if your student is not registered with disability services now, register them because it also protects them in a different way than before. Or, I mean, a different way than not registering. And I think working with disability services, they're not the panacea. You don't send a student there and they fix all things, right? But it is really a partnership and an identification of what is getting in the way now. Things are different. We're all home. And then what are the things that fit that need? Boston University has a good list of academic accommodations for mental health considerations. So if you Google search Boston University Center for Psych Rehab, accommodations, school, mental health, then you'll find the resource, and we'll post it too. And then you have to then adapt okay, if we're not in the classroom, what could this possibly be like at home? And can I get that? So something like an accompanier is a very hard thing when you can't go within 8 feet of someone, right? So, but thinking about like, well, does accompanier mean then a web-based person who helps you with your work, right? So thinking more along, being more flexible. So I think just the fine point is disability services is often viewed as like, well, they'll fix it. Well, that's not their job. It's all of our jobs. And I think what we're seeing here is that there is a chasm between CAPS, counseling services, and disability services for this group of folks, and that there may need to be something else to kind of bridge this gap. That's my belief. No one has the bandwidth to do all the things that students with mental health conditions need on campus. It's not CAPS, it's not ODS. I think big thing for this time is to be nice to the students that you're serving. Don't be frustrated if they don't reach out to you after 4 text messages or messages. They come up a week later saying like, I need help. Don't respond in a way that makes them feel like, well, forget it. Like, I guess you're not going to help me. I'm so happy that you reached out. I've been worried about you. I'm going to try to do everything I can to help you. I'm a little busy right now, if that's true, whatever. But make it feel like it's good to reach out. Some students just want to complain. They don't want you to do anything. So ask, do you want me to just listen, or do you want to help? Do you want me to help fix it? This gives you permission then to say like, okay, these are some of the things that I'm thinking, or these are some of the resources that I think that may be helpful for you, right? So ask, am I just listening right now, or am I helping to fix? So I think that is also helpful for students, because this is a hard time, and some people just want to throw up. They don't want to be told, okay, now you have to do this, because they're already doing a lot. It feels like they're doing a lot. And I think, I mean, for any of those of you folks who know me, I would say focus on what is getting in the way. So if there are symptoms that are getting in the way, who are the people that we connect to, and what are the ways that we can be strategic and intentional and help, right? This is hard for everyone. So people are saying this is harder because they have a mental health condition. That may be true, but also normalize that every single person thinks that this is hard. And it's not necessarily because you have depression, anxiety, psychosis, right? This is just really hard for everyone. And sometimes students need to hear that. And then focus on the basics, help people get organized, figure out how to navigate Canvas, figure out how to talk to their professors, understand like what's the difference between a pass and an incomplete, or an incomplete and the medical withdrawal. Educate students so that they can make good choices for themselves and not burn out and return next semester, because this feels really hard now, and it is. But figuring out how you can be strategic and how you can use your other resources like CAPS and disability services and voc rehab and the community-based providers, support education providers, like now's the time to really develop those resources and relationships within your community so that you can better support students should this continue. We now have gotten word that lots of schools are not going back for summer session, and there's some anticipation that some schools will not reopen for fall. So we don't know how long this will go on, so really connect people early and often. But this is like one of these moments, I think, that we can learn from this time to improve our systems so that this group doesn't continue to be vulnerable. Earlier, you had asked me something, Debbie, that I didn't respond to, which is what are the resources? So for those people who are interested more in disability service providers, you probably know this resource is called AHEAD, AHEAD. It's the Association of Higher Education and Disability. And those are the folks that are just a professional association for disability service offices. So for those of you who are in ODS or OAS, reach out to AHEAD. They should be, I know that they're thinking now about a series of webinars and responses to best support that population, this group. And I think that looking towards your professional associations to figure out what other resources are smart and use your supervision and mentorship. Like, reach out to people that you trust, that you know, and ask, like, am I doing this right? Should I be doing something different? Like, what should I be doing here? I'm struggling with the student. If we can be helpful in any way, please let us know. We do know it's a trying time for everybody.
Mm. And with that, Michelle, thank you so much for sharing your expertise. Thank you everyone for joining us. We will be posting the webinar and additional information on our website. Check our website for a live Google Doc of resources and articles about going to school while we're in this COVID-19 period. Thanks again, everyone. We'll see you next time.
Thank you.